Hi, everyone. Welcome. I'm glad you can join us today. I'm Dove Sachs. I'm the interim director of the Institute at Brown for Environment and Society. Today's event is being hosted jointly by the School of Public Health and the Institute at Brown for Environment and Society, which we refer to as IBES. IBES is a multidisciplinary institute focused on training leaders, conducting research, and making impacts in solving the world's most pressing environmental challenges. None of these challenges is larger than the ones that we face because of climate change. And none more important than the challenges that climate change poses for public health. At Brown, we have phenomenal students and scientists deeply engaged in studying both climate change and health. And as we turn now more broadly to focus on the intersection of these two public concerns, we're excited to host today's seminar, which is the first in a series of talks on this topic. And it's auspicious that we hold this first presentation today on Earth Day. So in a moment, I'm going to turn things over to Dr. Megan Rainey, Associate Dean of Strategy and Innovation at the School of Public Health. But first, I want to give you two bits of information. If you have questions that arise during the presentation, please write them down in the Q&A box at the bottom of your screen. When the presentation's over, we'll spend a few minutes asking as many of your questions and hopefully having them answered as possible. I also want to let you know that today's presentation is being recorded and will be made available publicly afterwards. All right, so without further ado, I'm going to turn things over to Dr. Rainey, who will introduce the speaker.
Thank you, Dr. Sachs. It's a joy to be here with you today to be helping to launch this exciting three-part series. Brown has a long history of important research on environmental science, and I'm excited that at the School of Public Health, we're increasingly taking on the challenge of climate change as a threat in the coming years and decades, but also right now to health. And so trying to address climate change, both from the point of view of how do we decrease the risk of climate change and how do we decrease the health impacts of what's already happening. Just have to look at the heat waves across the United States and Europe, the increasing rate of hurricanes, the deep freeze in Texas this winter, or the increasing flooding and the rise of the sea level even here in Rhode Island, to think about how climate change is going to impact the health of generations to come. This series is exciting as a collaboration between IBES and the School of Public Health as a first step forward in combining our joint academic, intellectual, and lived experiences in creating solutions together. And as you said, Dove, the fact that we're kicking this off on Earth Day just feels so fortuitous and appropriate. I'm absolutely thrilled to welcome today Dr. Jonathan Patz, who is a professor and John P. Holton Chair of Health and the Environment and Director of the Global Health Institute at the University of Wisconsin-Madison. There's really no one better than him to kick off our joint series. For those who don't know him, and most of you probably do, he was one of the first people to talk about the link between climate change and health, going back almost 2 decades. He was the chair of the Health Report for the first congressionally mandated US National Assessment on Climate Change, and for 15 years served as lead author of the UN's Intergovernmental Panel on Climate Change, or IPCC, the organization that shared the 2007 Nobel Peace Prize. So all of us that work in this intersecting area of climate change and health have a deep debt of gratitude to Dr. Patz. He has won numerous awards over the years, ranging from sharing the Zayed International Prize for the Environment to a Fulbright Scholarship, to the American Public Health Association's Homer Calver Award for Environmental Health Leadership. He's also an elected member of the National Academy of Medicine and is just, I can't give him more accolades, so I think that I will turn this over to him. He and I were talking a little before we started about how strange and also wonderful it is to do these types of talks on Zoom, and he made the very apropos comment that he is reducing his carbon footprint by joining us via Zoom rather than in person. And so another way in which we demonstrate our commitment to reducing climate change going forward. So Dr. Patz, thank you for joining us. Excited to hear what you have to say. And to all who are listening, do come back and join us for the future episodes in our joint series between the School of Public Health and IBES. So Dr. Patz. thank you, and I'll turn it over to you.
Right, Megan, thank you so much for your kind words, and Dove, for your collaboration. It's great to see Environmental Institute and Public Health Institute working together on this. That's what has to happen, and wanted to thank Dean Jha for his invitation to this as well. I know has some emergency thing he's dealing with COVID in India right now, but it is an honor to be doing this, especially on Earth Day, and also the first day of the Biden administration climate summit right now, where 40 world leaders are gathering. And I'll actually show you a little bit of an update on that in a second. So just to start off with, this is data from Jim Hansen's group. All of you know this, so I'm not going to waste too much time, but just to let you know that, measuring surface temperature around the world, things really are getting hotter. This is average summer temperatures in the Northern Hemisphere, 1951 to 1980, 83 to 93, 94 to 2004, 2005 to 2015. And notice the extremely hot days in the red color increasing dramatically. So it's not your imagination, things really are warming up. So from a health scientist point of view, my question is, looking at these extremes, these physical attributes of climate, which include, hot temperatures, sea level rise, and extremes of the water cycle, more droughts, floods, and fires, what does that mean for human health and well-being? And if you look in that green box, you can see the multiple exposure pathways through which climate affects us. And each one of those pathways has health outcomes on the right side, this column. And I'll give a few examples of these. So this is one reason why I have looked at climate change as the largest environmental public health challenge of our times, when you look at how many ways climate affects our health. So we'll go through some of these examples, from the direct effects of heat waves and air pollution to some of the infectious disease impacts. The bottom one, mental health and environmental refugees, probably the toughest one to really disentangle and prove, but possibly the largest challenge, maybe even the iceberg under the tip of the iceberg. And just for this last example, which I'm not going to talk beyond this slide, look at the situation right before the Syrian civil war. When we look at the top graph, which are trends in rainfall, the middle is temperature, and this third one, C, is a drought index, a Palmer drought index. Bottom line is it was right before the Syrian civil war. They had the most severe drought in their instrumental record. And of course, that war led to hundreds of thousands of deaths and millions of refugees. So this is where some of these indirect effects that will be very hard to prove could be very large and destabilizing populations and civilization itself. So these are tough challenges, and they're very complicated. Well, let's go to some of the simple challenges, or at least the simple direct effects, I should say. These are not simple challenges. These are direct effects. The heat wave in Europe was just a public health disaster. Upwards of 70,000 people dying within 11 days is just unconscionable. And you can see a pretty direct relationship. As the temperatures rose, we saw within 24 to 48 hours a spike in mortality. So we know that heat waves kill people. We also wonder about, when you think of external hot temperatures mixed with internal heat generating things that we do, like running a marathon, and you combine the internal heat with the external temperatures. This study a few years back showed that there are only 8 cities amongst 543 cities outside of Western Europe that could host a summer Olympics, because it's just going to be too hot. And of course, other heat issues we can see very dramatically with our unprecedented fire season last year. California and Oregon were on fire. And of course, we know that smoke is air pollution that harms people. And this recent study that came out showed that wildfire smoke is actually more hazardous than we thought before. So a direct impact that we need to be concerned about. Well, let's take a look at extreme temperatures around the world. This is a model showing that by mid-century, everything in yellow and orange is going to have record-breaking temperatures. And if you look at the bottom map, which is the end of the century, everything in red has a 90% probability or greater of having a record-breaking summer temperature. And the Roz Naylor, who's a crop modeler at Stanford University, looked at these temperatures, and knowing the climatic envelope through in which we grow food, said that those types of temperature extremes could double the risk of people that are at risk of hunger. So this is dramatic, and this is by mid-century. So another public health very serious concern with climate. But you know, some plants will benefit from more CO2 in the atmosphere and higher temperatures. So some plants like ragweed pollen and poison ivy will do just fine with higher CO2 and warmer temperatures. In our state of Wisconsin, we've already warmed 1 degree Fahrenheit above pre-industrial levels. The Northern Hemisphere has 27% more CO2. Look what that does to the ragweed pollen season. So especially at higher latitudes, you know, ragweed pollen season is now 2 to 3 weeks longer. So this is a problem for anyone with asthma. And I want to shift gears and remind you that it's not just warmer temperatures. It's not just global warming. It's the global climate crisis that includes extremes of the water cycle. And in the upper Midwest, you can see everything in green has had, you know, 7 inches more precipitation compared to historic, 50 years since the 1950s. And the hashtags mean this is statistically significant. And I'm highlighting the state I live in, Wisconsin. So we've really seen dramatic flooding in our area. And of course, this list on the left, many different health outcomes from flooding. We've conducted a study asking the question, if we're going to be seeing more rainfall, and by more, I mean heavier, more intense rainfall events, because hot air holds more moisture. So when it rains, it can rain really hard. So we asked this question that if the projections are for more intense rainfall, what would that mean for combined sewage overflow events, which we have in this country every year? It's a very expensive fix to separate stormwater with sewage. Some cities do it, but others can't afford it. We see over 1 trillion gallons of sewage contaminated stormwater overflow into our lakes and streams every year. That would keep Niagara Falls running for 18 days. We have that problem right now. And with climate change and intensity of rainfall, that's going to worsen. And we did an analysis showing that Chicago and the water basins that feed its drinking water could see a doubling in the number of these combined sewage overflow events. So flooding and heavy rainfall puts a high risk on our water systems. And so the obvious thing, of course, is that flooding poses these water contamination risks. But what do we see in emergency rooms after floods? We see people coming in with asthma because when they go into their homes, they see this type of situation. And so this is quite serious. And it's especially a problem in low-income settings. And this headline, a racist past, a flooded future, formerly redlined areas have $100 billion worth of homes facing high risk, 25% more than non-red line areas. So this is an equity issue. You know, the people at highest risk of these floods and the health impacts of the floods are in poor neighborhoods. So there are some people that argue that global warming's greatest threat may actually come from the smallest organisms. And of course, when you think about the difference between us mammals and this mosquito, you know, we are warm-blooded, so our body temperature is always about the same. For a mosquito that is cold-blooded, whatever the air temperature is, that's her body temperature. And if she's an Aedes aegypti mosquito who can carry yellow fever, dengue virus, and Zika virus, you know, small changes in temperature have huge effects on transmission dynamics. We asked the question, before the Zika epidemic happened, was there a sort of an unusual climatic situation? Well, it turns out that the El Nino of that winter, right before the epidemic of Zika, that was the strongest, or tied with the strongest El Nino, tied with the 1997 event, but also lasting longer. So this El Nino event was dramatic. One of my climate scientist colleagues, Dan Weimott, he plotted temperatures during the El Nino, and what you're seeing in the red color are temperatures that are higher than 2 standard deviations above a 60-year constructed average temperature. So very high temperatures. And if you look at what does temperature mean for transmission dynamics, that particular mosquito is very, you know, climate sensitive. And vectorial capacity means if you have one case of dengue fever or Zika virus, you know, what will one case of disease lead to as far as more cases? You've seen this with COVID and talking about R naught, right? So vectorial capacity is when you have a vector-borne disease, and it depends on how many mosquitoes are there, their biting rates, and things like that. And so it's very temperature sensitive. So the vectorial capacity for that mosquito to transmit Zika and dengue happened to be at its highest level right before Zika erupted. And of course, this is complicated. How did the virus get to Latin America? People think either the World Cup or canoe races that brought people from Polynesia that had the virus in their blood, brought them into Brazil. We're not sure, but definitely an international component. But once the virus was there, did this unprecedented, these temperatures help fuel the fire and have Zika become established? I've been telling people Zika acts just like dengue, same virus family, same mosquito vector. But in actuality, laboratory studies show that Zika virus has a 5 degrees centigrade warmer temperature optimum for transmission compared to dengue. So it's possible, I can't say for sure, but it's possible that these climate relationships with Zika could have been a strong contributing factor for Zika really erupting when it did. So those are a couple of examples, the bad news of why, you can see from the climate scientists, climate change, it's real. Also, climate scientists has said it's us, we're causing the problem, and it's bad. Everything I've showed you, there are some bad outcomes from the climate crisis, and they affect our health. But now I want to say, that there's a flip side of the story, which is that combating climate change could be free. And for the last 7 years, I've been talking about challenges and opportunities for global health, that solving the global climate crisis could be the greatest health opportunity of our times, and how a low carbon future could improve global health and achieve economic benefits. So why am I so hopeful here? Well, if you look at these three big sectors that are to the right of this yellow dotted line, the energy and electricity generating sector, food and land use, and transportation. So energy, food, and transportation. Those three sectors are very much related to our health and to the environment. So for example, the energy sector, air pollution from burning fossil fuels, according to this latest study out of Harvard University, shows that fossil fuels lead to 8.7 million premature deaths every year. This is an expanded database. It's an update from the latest. You've heard the number 7 million deaths, premature deaths from air pollution every year from WHO. But this is a brand new study. It may be higher. So almost 9 million premature deaths just from burning fossil fuels. So golden opportunity here. The food system and the food sector. If you look at the latest, the Eat Lancet Commission report that came out 2 years ago, they have a universal healthy reference diet. It's a diet we all know. It's pretty much the Mediterranean diet, very low red meat or no red meat or dairy, a little bit of fish, more fruits and vegetables, the diet that you all know, that they say that if the world, followed this diet, that would be 11 million premature deaths avoided every year. And finally, the transportation sector, the physical inactivity and sedentary lifestyles is causing 3.9 million premature deaths a year. If you add up all three of those across those three sectors, we're talking about nearly half of all premature deaths every year. This is a golden opportunity. And even for people that might not believe in climate science, the actions that we need to take across those three sectors, whether or not you believe in climate change, is just an enormous gold mine for health and well-being. And when we look at the COVID-19 pandemic, there are a couple of other things. Well, many of us know about the land use change, habitat destruction that has led to increase the risk of zoonotic disease spillover. So that's sort of the front end of the COVID pandemic. Mix in a little bit of wet markets and international travels, and you have a pandemic. But at the back end of this pandemic, we also saw this study led by Francesca Dominici out of Harvard, comparing the top map of air pollution in the United States with the bottom map of COVID-19 deaths, controlling for all the types of factors you need to control for in an epidemiologic study. They found that a tiny increase, 1 microgram per cubic meter of PM2.5, fine particles, leads to an increased risk of 8% for dying for COVID. That was striking. I couldn't believe that. I mean, so you have environmental factors disrupting nature on the front end of COVID, and the back end increasing the risk from air pollution. The other thing with COVID and air pollution, we've had to shut down the global economy. Social distancing, we've had to shut down the global economy until we had this vaccine. So what is any clearer than this type of image, comparing today's air quality compared to business as usual. On the left is the before image in New Delhi, India. And on the right is, what we're seeing after shutting down fossil fuels. There have been a few studies that look at this, looking at the air quality from shutdown in China from 2 months of fossil fuel reduction. They're talking about over 24,000 lives saved in China because of less air pollution. Looking at a similar time, a couple of months of less air pollution in Europe, it's not quite as dramatic because China has much more air pollution, but still in Europe, more than 2,000 lives saved because of a reduction of pollution. So we all know how bad air pollution is, but to see this stark before after shutting down the global economy is pretty striking. So, at this time, I asked this question, do we really want to uncork the current fossil fuel economy, or do we want to build back better, as the UN is talking about, as the Biden administration is talking about, and as they're all talking right now, as we speak in the climate summit that Biden is leading, or do we want to get back to an energy economy where everyone prospers and to truly build back better? Of course, after the Paris Agreement, the world leaders asked the Intergovernmental Panel on Climate Change, the IPCC, what would it actually take to level the amount of warming, to just limit it to 1.5 degrees centigrade. In the Paris Agreement, they're saying we've got to stay below 2 degrees centigrade, or according to the impact assessments, we get into dangerous territory. Ecosystems fall apart, society falls apart. Above 2 degrees, it gets dangerous. And can we stay below 1.5 degrees centigrade above pre-industrial levels? Well, the IPCC came back to the leaders with this report published in 2018. And the bad news is that to stabilize at 1.5 degrees centigrade global average, we have to cut emissions by 45% by the year 2030. So in nine years from now, we have to cut emissions, mostly from burning fossil fuels, but also conserving nature, cut emissions 45% and get to net zero by 2050. So, stop calling it climate change. It's climate crisis. And because climate change affects our health, it's a health emergency. But, again, even if you don't believe in climate change, and it's not a belief, it's science, so forget about believing it. If you don't have any regard for science and you don't want to pay attention to that, let's just pay attention to what happens if we clean up our energy system. In the United States, we have somewhere between 50 to 75,000 premature deaths every year. This is from 2017. We are getting better, and coal-fired power plants are retiring. So this number is gradually improving already, but still, people die from air pollution, tens of thousands of people in the United States. Get rid of coal and you save lives. Another thing that's argued about is, well, do we want to pay more for clean energy? And this is a study from, 8 years ago, looking at what would it cost for clean energy? What would it cost to avoid emitting 1 ton of CO2? So clean energy, not burning coal, going with renewables, it might cost $30 to avoid emitting 1 ton of CO2. But when we burn coal and oil and produce greenhouse gases, we also produce all the nasty pollutants that we know. And simply from the reduction in PM 2.5 that would accommodate this 1 ton reduction of CO2, the health benefit from avoided mortality, hospitalization, and absentee workdays is about $200 for every avoided ton of CO2, which means reduced PM 2.5. And so the policymakers need to answer this question, which number is bigger? Because most of them are only focused on this number on the left, $30. They don't want to pay more for clean energy. And they are completely forgetting about the huge health benefit that all of you in this audience need to remind them that that number is far bigger. And in polluted countries, it's even way bigger. But this $30 is now being questioned because look at the price of solar. It's dropped 99% in the last few decades. And, here's unbelievable news, but it's from a reliable international renewable energy agency that goes through very extensive quantitative analysis. And they found that now, if you remove all subsidies, that the cheapest way to generate electricity is from renewable energy and batteries. So we don't have to wait for technology. It's here. There's just no excuse to shift over to clean energy. And we just need the political will, because the technology is here and the health rationale is definitely here. It's been here. So golden opportunity. We don't need to wait. I'm going to speak a little bit less about the food and transportation sectors, but I want to put them in here before I close. This is a very important report that came out, the Lancet, one of the Lancet Commission reports, the EAT Lancet Commission. And I'm going to show a complicated figure from the report, but I'm going to just break it down and tell you that this universal healthy reference diet, you can read what it's all about, and we all know it, more fruits and vegetables and all these other good things, and no or very low amounts of red meat, processed meat. So in this diagram, everything to the right of the dotted line and the sort of shaded area to the right of the dotted line, that's excessive, unsustainable, and unhealthy food. So if everyone took up this universal healthy reference diet, and we'd be to the left of that dotted line, it would be tremendous benefit for the environment and our health. And I'll just highlight from this a little bit complicated table and just highlight the main findings, that getting to that universal diet, which is very, low carbon intensity, low energy, low fertilizer, it would prevent about 11 million deaths annually, because it's health promoting. And of course, less energy, fertilizer, all the other inputs required. It's extremely beneficial for the environment. So huge gains in our food system. And the last sector, transportation. We all know that exercise is good for us. Here's a study that looks at comparing cities with the highest rates of walking and cycling for work commuting, with obesity and diabetes rates that are lower. And of course, exercise is more than just burning calories. It's reduces heart disease, cancer, dementia, depression. Contracting muscles are chemical factories for really healthy chemicals in our body. So, it's a no-brainer. We need to design cities for people and for alternative, equitable transportation, and not only for private motorized vehicles. So I'm going to wrap up with a couple of a summary slide of a study that just came out of the Lancet, the project. It's called Lancet Countdown, countdown carbon, and what does it mean for health indicators. This is looking across the energy, food, and transportation sectors, places around the world that will have health benefits from low carbon. You can see that across 9 countries that they studied, that represents 50% of the world's population and 70% of global emissions, carbon emissions, greenhouse gas emissions. Millions of people benefiting, millions of deaths averted from across those sectors. And because it's Earth Day and the first day of the climate summit, I saw this morning in the headlines, Biden's new US target, the nationally determined commitment for greenhouse gas emissions. Instead of 28% as it was going into Paris, it's now 52% carbon emissions by the year 2030. This is great. And also, according to that Lancet Countdown report, a low carbon society across energy, food, and transportation sectors in the United States would avert 1 million American deaths every year. And the health benefits from reduced mortality and hospitalization and work days could offset the investment costs of clean energy of up to 40%. So again, it's great news. No reason not to go full throttle on an electric vehicle, full throttle electric vehicle, electric bicycle, and to move forward without any delay. I'll end by just saying that there is a role for health scientists and, of course, working with environmental health scientists, urban planners, food system experts, that there are organizations that are out there, the Medical Students for Sustainable Future, MS4SF, the Medical Society Consortium on Climate and Health, the Global Climate and Health Alliance, Healthcare Without Harm, Global Green Hospitals. And so there are a lot of, you can see 17,000 hospitals on board. This was a call to action that was sent into the Biden administration by some of these groups. And one healthcare system, the National Health Service in England, is really moving forward fast and pledging to be net carbon zero by 2040 and getting to 80% of that goal quickly, like in 7 years, to just pull out all the stops and go to low carbon. So we've got leadership across the healthcare system. And I'll end by this wonderful image I saw from an op-ed. You know, why don't we treat climate change like we're treating this infectious disease? Because after all, climate change is a global health crisis. And one more cartoon that I thought was fitting when we look at, you know, COVID-19 is an absolute crisis, disaster. It is just devastating. But, you know, I think we're going to get through this. And ideally, if we adopt conservation of nature and reduce the number of zoonotic disease spillover events, hopefully we might reduce future pandemics. But then there are these other big things that are happening. And some people argue that the COVID pandemic is a fast motion parallel to the climate change crisis that we're faced with, because the climate, you know, scientists tell us it's real. We know it's happening. We need to act. I might ask the question, you know, how would we have responded to COVID if we knew that it was coming 5 years before it hit? Can we, knowing that climate change is real and it's happening, and we know how dangerous it is, can we start acting on it right now? And that last report from the IPCC says that we have a window of about 9 years where we really do have to act on it quickly. So my last slide is just to make sure that you spread the word that the climate crisis is a risk to health. It's a health crisis, but that action, what we do to solve the climate crisis, offers enormous health opportunities. So promote this message. The first thing to do is talk about it. I have a 19-minute version of this. If you just Google my name and TEDx, you know, you can spread the word and get this to your networks. That climate change, it's a health crisis, but also a health opportunity. And with that, I thank you very much. You can follow me on Twitter. I only put out good stuff, and I will stop sharing the screen and we can begin a discussion.
Comprehensive and important. So we've got some time to take questions. And so if you're in the audience and have a question, please enter it into the Q&A. We'll try to look at as many of these as possible. Let's see, I've got one here that's asking, you know, how do medical groups, and given the sway and importance they have, like what's their role in lobbying on climate change and climate change policies? And do you think that that they've done all that they could do so far, or is there more to do, and do you have suggestions?
Well, that's a great question, and there is so much happening. And I'm gonna give you some of the findings of a colleague of mine, Ed Maybach, who works with Tony Lasierowicz. The two of them have been doing this 6 Americas survey every year for many years now. And it's about attitudes on climate change. And number one is there's a number of people that are concerned about it, and it keeps growing. Right now, I think somewhere about 60% of people are quite concerned about climate change in the United States. So that's one thing to acknowledge. The second thing is that from their research, who are the most credible voices? And it turns out that nurses, doctors, and pharmacists, health professionals have the highest credibility rating, even when it comes to communicating climate science. So, so the health community, they're trusted messengers. So given that, there has been a big effort, and this is led by Ed Maybach out of George Mason University, out of his Climate Change Communications Center. And I know that Brown and Yale have other similar things, that there is an effort, I pointed to one of them, the Medical Society Consortium on Climate Change. So that's, I think, about 30 US medical societies, including the AMA, that have come on board to say, hey, this is real. We are the mainstream medical profession. We are concerned. And that group and state level groups, we have our own Wisconsin Health Professionals for Climate Action that began about 18 months ago, rapidly growing. You're seeing far more practicing health professionals that are out there meeting with public utilities, meeting with hospital CEOs, meeting with a number of people. So it's a very active front. I think it's a great advance. And I'm glad you asked that question.
Okay, we've got another question for you, which is, you talked about warming conditions in the tropics associated with an El Nino event and how that may have facilitated the Zika virus outbreak. And you mentioned a couple of other vector-borne diseases. You didn't really talk about how some mosquitoes seem to be cold limited and what parts of the world they live in. And as things warm up in the temperate zone, whether we should see a sort of shift in some of these tropical vector-borne diseases move into places like Europe and the United States. And could you comment on how concerned we should be about that, or whether we should be doing anything in particular now?
Right. So because I'm talking to Brown University experts in environment and health, I'll just state that, of course, each of these infectious diseases is multifactorial, very complex things going on, from human migration to government programs and bed net programs and all sorts of things. So it's very complicated. But to the extent that you have to have the adequate amount of warming degree days for one of these vector-borne diseases to actually develop. We know a lot about malaria, for example. You need a certain number of degree days over 15 degrees centigrade for Anopheles, for Plasmodium vivax malaria to develop in the mosquito. For the more dangerous Plasmodium falciparum malaria, you need, I think, the X number of degree days at 18 degrees centigrade. So we know that these tropical diseases must have warm enough temperature for them to even develop. So bottom line is, yes, they're tropical diseases because they need warmer temperatures. But just a reminder that it's not just climate, that it's all these other factors that need to play in and need to control for. Given that, so you asked this question, are diseases changing in geography and their transmission dynamics? There are some studies that show that malaria is creeping up into the highlands areas in Eastern Africa. So temperature goes with altitude. So higher altitudes is a great surrogate for temperature change. So if you see malaria moving up in altitude, that's probably controlling for migration and other factors. That could be a temperature effect. We're seeing studies that show Lyme disease moving up in latitude into deciduous areas of Canada. So Lyme disease is beginning to move north. Some other vector-borne diseases in Europe, we're seeing changes in their geography, but it's complicated, and it's very hard to answer a question to say, we have enough longitudinal data over decades controlling for the zillion factors that you need to control for to really be able to attribute some of these changes to long-term climate. So a lot of the studies we've done have been using El Nino as a surrogate for anomalous climate conditions, because that's what happens with El Nino. Every 4 to 7 years, you see very unseasonable either drought or flooding or high temperatures or low temperatures. It depends where you are in the world, how you're affected. But there are lots of studies that show changes in infectious diseases linked to El Nino. And we certainly see this with dengue fever, which is very seasonal in Southeast Asia. But the peak years coincided with the very strong El Nino years, which happen to have a strong climate signal for places like Thailand. So most of what we've learned from infectious diseases come from studying El Nino events. A few diseases, maybe cholera in Bangladesh, maybe high altitude malaria in Africa. We can see some of these attributed to climate change, but it is a tough thing to study, to have longitudinal data long enough to control for all the other confounding factors.
Oh, thank you. We've got another question here, which is interesting. It's asking, given that some warming is sort of baked in at this point, and given that some coastal areas are going to be subject to stronger storms and flooding events, and certain tropical areas may have increased disease burdens, what do we think about human migration? Like, should people in some of those places consider moving away from the coasts or away from certain tropical areas? And how do we think about human migration in the context of climate change?
Right. Another great question. So obviously, yes, there is inertia in the climate system. The greenhouse gases that we've put out today will last 50 to 70 years in the atmosphere. So we are committed to some warming. The question is, how extreme do we want to go? And obviously, the quicker we can curb our emissions, the lower we'll level off at a certain temperature of warming. So we do need some adaptation. We need to be prepared for these climatic extremes. We need to build, just like we saw with the cold snap in Texas, we need to be prepared for these types of unseasonable events. We need to build our water infrastructure to be prepared for heavier rainfall events. So we are going to see inevitable intensification of climate variability, and we need to adapt to that. But we need to adapt without maladapting. For example, if we're going to be relying on air conditioning, we need to make sure that the energy sources of electricity are not contributing to the problem. So if we're going to have air conditioning as a nice adaptation to save lives in heat wave, we need to make sure that electricity comes from clean power, so we're not just kicking the can down the road and trading problem today and then sacrificing other people by the extra pollution. We actually did a study and found that air conditioning for cooling demand by mid-century, if coal-fired power plants are the source of the electricity for the air conditioning, you kill 1,000 more people from that air pollution. You save lives from a heat wave, but you kill people from the air pollution if electricity comes from coal. As far as, flooding and trying to change zoning so you have less development in dangerous floodplains, I think we need to consider that. Should New Orleans have rebuilt where it's very prone to more hurricanes because of the levees on the Mississippi River and less sedimentation to the coastal wetlands? The wetlands have been there are less buffering of hurricanes now. So, New Orleans is going to see this problem again. But that's pretty difficult to go past those cultural norms and leave home. And, so those are tough questions about, do we relocate or do we fortify where we are? I think there needs to be policies, smart policies as far as moving forward on where we should be developing. We should have smart cities. We should have sustainable cities. We should have flood resistant areas. But we also don't want to be building in the most hazardous areas. So it's a combination of policies. It's going to be not a silver bullet, but more like silver buckshot, a million different types of policies that we need to be considering. But when we see how interconnected a lot of these policies are, having smart planning and, for example, smart cities where we think about energy and green space and transportation and food systems, there are a lot of things that you can do that have multiple benefits across different outcomes. So we need to be thinking more strategically in that way. But yes, we need to adapt and be prepared for the inevitable. But, we don't want to keep mopping up the water on the floor and be preparing and adapting and forget about turning off the faucet, which is to also make sure we're looking at mitigating the root cause of the problem, which is burning fossil fuels. And the health rationale is that, you turn off that faucet, you turn off that fossil fuel emissions and get to low carbon, we have immediate health benefits. And we have to be pushing that message really hard that whether or not you buy climate change, getting to a low carbon future is beneficial to health immediately. Plus, it will forestall or lessen the impact of the climate crisis.
Yeah, I found that aspect of your presentation particularly compelling. Just this idea of the immediate benefits that we get from the immediate health benefits we get from reducing reliance on fossil fuels. So this last question, we'll ask one more question, and it sort of builds a bit on what you just spoke about. But it's about the infrastructure planning going on right now. And the question says, how is climate change being considered as part of the new infrastructure plan? And what are the cost benefits being considered?
Another great question, and very timely as we're talking about infrastructure planning, the American Jobs Bill, the American Jobs Plan. And in that, of course, the first one out of the gate now is we're talking about transportation infrastructure. Absolutely, the health narrative needs to be in there. Jobs are fantastic, and getting jobs are good for our health as well. But I do think that it's a missed opportunity not to also highlight the health benefit from the American Jobs Plan. And when we talk about transportation, 53% of Americans don't even meet the minimum level of exercise that's recommended. And sedentary lifestyle is leading to chronic diseases, obesity, diabetes, heart disease, and cancer. So there's a physical fitness benefit there. When we talk about designing bridges and tunnels, let's not just be talking about automobiles. Let's think about tunnels and bridges for bicycle pathways that interconnect networks that would make for, promote physical activity and be quite equitable as well. So transportation planning, we definitely should be weaving the health narrative into that, just as we should be weaving it into energy. And, you know, we did a study in Wisconsin and found that if we got off of our coal dependence, where we spend $14 billion out of state to get our electricity, and it comes from coal mostly, we can generate all of our electricity in state, mostly from solar and wind, but also conservation measures, and also keeping nuclear right as it is at like 4%, just leave it alone. So we can have a green energy infrastructure, generate electricity, and have a net of 162,000 new jobs, but also reduce almost 2,000 deaths every year from reduced fine particles and ozone pollution. And that equates to $21 billion every year in health benefits. So, you know, the American Jobs Plan and infrastructure planning has so much to do with health. And I think we do need to voice that because it's not in there. I'll just go back to Ed Mabach, a recent survey of Eco America. They surveyed about 1,000 Americans, and they found that the health narrative around action on climate change is about 5 percentage points above jobs as a motivating factor. So jobs is a great motivating factor, but health is even more. And I think we're not seeing it, and we should get it into the narrative. Definitely, we need to be pushing forward that this is about our health, and it's a golden opportunity, jobs and health, and let's get that into the public discourse.
Well, that sounds great, Jonathan. So we're out of time, and I mean, this was just amazing and fascinating, and I want to thank you again for Brown and from Dean Jha and myself and Dr. Rainey for coming. We're delighted to have you. So thank you so much. We'll be in touch with you shortly.
Well, thank you for this great opportunity to present to such a great group and looks like a nice audience.
Oh, yeah, we had a great turnout today too. So, all right, well, take care, everybody.